Sarah is a 14-year-old schoolgirl experiencing her adolescence. One day, she came to her mother and asked,
"Mom, how do women get pregnant? Can we prevent someone from getting pregnant? Why do teachers always say not to have intimate relationships with boys?"
Immediately after hearing these questions, her mother panicked and became irritated. She suddenly started to blame Sarah.
"What nonsense are you asking? Behave according to your age. Don't ask for reasons. Just do what elders say."
Sarah never received answers to her questions. Meanwhile, a senior student at her school showed some interest in her. Sarah was also attracted to his handsome looks, and they built a connection that they referred to as love. Days, weeks, and months passed, and Sarah began to show some unusual symptoms, which led her mother to take her to a doctor. Sarah and her family were devastated by the medical reports. She was 5 months pregnant.
Do you think this is a fiction or just a hypothesis? No. This is a real case scenario we adapted from a 2008 study on adolescents' perception about sexual healthcare services in Sri Lanka. This is a universal scenario. It is not limited to a country. When there's lack of proper communication between adult and adolescents, such tragic situations can arise. Before we move into our main topic, let's see what adolescence is.
Adolescence is the stage between childhood and adulthood. According to the American Psychological Association, it ranges from ages 10 to 19. However, a 2018 study suggests that contemporary understandings extend this period to ages 10 to 24. The physical maturation of the brain and body during adolescence leads to intense psychological and bodily changes, which Stanley Hall referred to as storm and stress. Due to this, adolescents need trustworthy adult support, especially concerning sexual health. Sexual health is a state of physical, emotional, mental, and social well-being related to sexuality, not merely the absence of disease, dysfunction, or infirmity. Also, it consists of positive and respectful approaches to relationships. Eventually, the possibility of having pleasurable and safe sexual experiences. Adolescence is a period when sexual health is often challenged. Let's take a look at these challenges. Higher risk of unwanted pregnancy, unsafe abortions, sexually transmitted infections, and high prevalence of early marriages, a high prevalence of early childbearing, mental health issues. Sri Lanka, a South Asian country with a collectivistic culture, has inherited closely woven generational bonds that work towards collective goals. This cultural tapestry seems to contribute significantly to enhanced communication, especially adult-adolescent communication. Is this practically evident as well?
If we consider the practical scenario, unfortunately there are many pitfalls. In Sri Lankan culture, the bond between adults and adolescents is strong because teenagers are closely tied to parents, grandparents, relatives, and teachers. This bond is reinforced by cultural influences where adults are always respected, adolescents are expected to obey without question. Sarah, a pseudo character from the beginning, faced such a situation. This authoritarian nature, largely influenced by social, cultural, and the religious factors, dictates what should and should not to be discussed with adolescents. Human sexuality is one of such underrated topics among Sri Lankans adults and adolescents. Thus, these traditional patterns of communications can sometimes make adolescents reluctant to express their sexual health issues. It causes unrecoverable detriments.
Reluctance doesn't mean that these adolescents do not need to express their concerns about sexual health. However, they have some specific reasons for keeping their burdens to themselves, especially due to the unavailability of an adult to discuss these matters. Referring to the research literature, we found some common reasons for this. On the other hand, these are the barriers, myths, misconceptions, and perceptions that negatively impact communication about sexual health between adults and adolescents. Let's talk about them deeply.
Lack of trust, especially teachers. In Sri Lanka, many students do not trust teachers when it comes to talk about sex. They are afraid to being a judge or laugh at them. Negative impressions about healthcare workers. Many people think healthcare workers also will judge them if they talk about sexual health. This stops them from getting the help they need. The next one is poor knowledge, especially among the parents. Parents often don't know much about the sexual health, so they can't teach their children the right information. This keeps myth and wrong ideas going. Lack of resources, especially we need to talk about the lack of resources. There are not enough good materials on sexual health in Sri Lanka. Without these resources, the people can't learn the facts. Firmly held beliefs and the stereotypes is one of the significant barriers. These ideas make people think that being curious about sex is wrong. Also victim blaming, that is most important part in the Sri Lanka. Victim blaming is common where victims of sexual abuse are blamed for what happened to them. This makes victims feel ashamed and afraid to speak up. To understand the human sexuality better in Sri Lanka, we need to break these barriers. We can build a trust, learn more, share resources, and challenge wrong beliefs to make our society more understand and caring.
A research conducted in 2008 on adolescents' perception about sexual health services in Sri Lanka emphasized malpractices of adults when discussing about sexual health concerns. This category of adults especially includes professional healthcare workers and teachers. Let's see what are these malpractices. Negligence. The present healthcare system in Sri Lanka doesn't have a considerable provisions for male adolescents when it is compared to the females. Inattentiveness and impatience in listening. Sometimes adults do not pay their attention to what adolescents express. This largely demotivates adolescents to express their inner feelings. Asking embarrassing questions related to their sexual health concerns publicly, especially in front of their parents, friends, in schools, classrooms, staff rooms. This makes them more likely to avoid expressing their sexual health concerns. Tone of blaming. Once adolescents reveal their sexual health concerns to adults, some adults tend to take them judgmentally and negatively. That harms the relationship between adults and adolescents. Sometimes adolescents are discriminated, stigmatized, bullied, and marginalized among their peers, teachers, relations, and also family members after they reveal their sexual health concerns. This causes severe impacts such as re-victimization. Not providing rich information. Adolescents expect rational and in-depth answers for their sexual health concerns because they are explorative to find these things. Up to now, we have discussed the major sexual health concerns that arise from communication barriers and malpractices of adults. Let's have a quick recap.
Lack of trust and negative impressions of professionals. Limited knowledge among parents. Insufficient resources for adolescents to learn about sexual health. Stereotypes related to sexual health issues. Fear of blame, re-victimization, and stigma.
Now we have a good understanding of how malpractices in adult-adolescents communication causes bottling up sexual health concerns in adolescents. Research identified several major health concerns related to the Sri Lankan context and the negative consequences due to unattended or poorly addressed health issues. It is important to note that these concerns can differ in the global context.
Let's explore the issues and their consequences. The first one is problems regarding menstruation cycle and school absence. Students often don't understand the menstrual cycle well. This lack of knowledge can lead to make girls missing schools during their periods. These days we have to talk about the sexual harassment. Sexual harassment is a serious issue. Victims often don't speak up because they feel they will be blamed of sexual transmitted diseases. Many people don't know much about the sexual transmitted diseases. This lack of knowledge can lead to more infections and health problems. Masturbation related issue. There are many myths about the masturbation. Some believe it is harmful, which can cause guilt and shame for those who do it. Addiction to pornography and other sexual behavior is a growing problem. When there is a problem, there is also a resolution. Almost all negative consequences that arise from miscommunication between adults and adolescents can be successfully addressed. Empirical research evidence suggests promising recommendations to mitigate these negative impacts. Let's discuss.
Improving awareness among teachers, parents, and other elders. This awareness can be done through community-based programs or effective advocacy programs. Focusing on comprehensive sex education programs instead of abstinence-only program or combination is another promising recommendation, because emphasizing safe sexual approaches is better than motivating adolescents to bottle up their feelings. More knowledge for adolescents. Some studies suggest that adolescents prefer to gain more knowledge to themselves rather than empowering their parents' knowledge. Direct contact to correct professional. Adolescents report that repetitive exposure demotivates them to express their burdens. Trainings for enhancing skills of healthcare professionals to work with adolescents. Such programs need to focus on implementing trust and emotional safety while adolescents to feel included and autonomous. Implementing equal sexual health services such as special clinics without discrimination on gender, race, ethnicity, and social status.
Many adolescents, like Sarah, face challenges due to poor communication between adults and youths. This issue is tragic at individual, familial, and societal levels. This session was based entirely on research evidence, which aimed to increase awareness about adolescent sexual health. We then focused on the Sri Lankan context, highlighting barriers, misconceptions, and malpractices in discussing adolescent sexual health. In the latter part of the session, we discussed the negative consequences of these communication barriers and malpractices and provided evidence-based recommendations.